thank you all for joining us today. We're really happy to have everybody join us for our webinar today on interoperability and its impact on patient care. Today, we're going to talk with Chris Carter. He is the CEO and founder of ChartRequest. And Chris, I'll turn it over to you.
Thanks, Kate, and welcome everybody. This webinar is going to touch on some current state items, some timely events that we'll hit on, and we'll talk about how ChartRequest fits into that role. And so, just to level set a little bit, interoperability, right? I know there's a lot of buzzwords, but it's not just about technologies and APIs and pipes. It's really about people. And when data moves, everyone who touches care, right, who has to use this data feels a little bit of relief when it moves faster. So every week, I meet with HIM leaders, IT leaders, general counsels. Our teams meet with these great folks who are doing heroic work to move data with the tools they have that weren't built for this century. And interoperability really shouldn't feel like triage. The data should just move. And we have some challenges in the U.S. healthcare system. Everybody knows that, and ChartRequest has been working for over a decade to continue to solve some of those. So our goal here is simple: reduce friction for anyone who needs health data. We want to do it securely, we want to do it transparently, and we want to do it fast. So, and then with the new HHS actively enforcing information blocking rules, this is, as of last week, some new announcements. We believe the difference between policy and practice matters more than ever. So today we're going to show you how our teams are hitting 5-day turnaround time guarantees, proving out compliance, helping you prove compliance, and giving your teams hours back to service patients and help with patient care. And so today, I just want to show, let you guys know what we're going to be sharing, but we're going to cover the interoperability path, how we reduce friction. We're going to talk about some concrete outcomes and where this is all going, plus the information blocking communication that came from HHS. From the attendee list that I reviewed, we have an audience full of legal, operational, compliance executives across various settings. We've got folks in the ambulatory care setting, rural hospitals, regional health plans, as well as multi-state integrated delivery networks represented on this webinar. So ChartRequest has current clients in each of those segments. We hope we can be helpful in your organization's compliance journey. And thank you so much for joining us. We look forward to questions here in a bit at the end. And so when we think about interoperability challenges, I think it's important to frame the why a bit. And so we encourage our clients to design for access by default, right? And so legacy habits are hard to change, but with focus, we can do it together in 90 days or less. It's hard to give up paper. Postage is easy sometimes. It's what you've been doing. Phone trees exist, right? People are used to pushing buttons, but all those things are a little ancient in today's time. We still use those. We still have to embrace that current state, but we really have to work to move forward in this new environment. From a staffing perspective, we think about, the number of people required if we do not have technology enablement. It's not going to work anymore. Throwing people at the problem won't work, and it's slow and it's risky. And so we've all experienced that. We've all managed from small businesses to large enterprises. We have to, we want to have the best people that we can have and have them be the best trained. But the more we can enable them with software and tools, the better they're going to be. And so just to give a little bit of a risk backdrop, the OCR penalties are starting to hit 6 figures routinely. Got a couple of examples here that we talk about, but when you really talk about what the problem or what the opportunity to fix is, it really evolves around some of these legacy tools. So misdirected faxes, right? Caused the breach of Centera, right? Paper and fax mistakes caused the issue at St. Luke's, and so these analog or kind of legacy workflows, paper and fax, it's not your friend. It's not your friend in any capacity. I know it's not fun to go find solutions for this, but we want to do our best to help with that. And so, but I think more than that, nobody wants to be responsible for a mid six-figure fine, right? So again, just we have to really rethink and design for access. And at ChartRequest, we have a 5-day turnaround time guarantee, right? And the only way we can do this is with our software pathways. The only way we can do this, right, is by not gating PHI, not gating information. But we have to keep it secure. We have to be transparent. We have to give you the tools to prove that you're doing that. And just to hit a little bit on this September 3rd announcement for everyone. I've been speaking about information blocking for the last 5 years. Everything has been kind of put on the delay or the back burner or comment for quite some time. And so this is a little bit of an about face for HHS. I don't know if it's a changing of the guards or if it'll be more of the same, but I don't think we can wait around to find out with the way that the penalties have shaped up. And so we know that as of September 3rd, 2025, right, there's HS built out an enforcement alert, right? They want to signal that you can't do things that might cause patient harm or and really what that means is slow the coordination of care. And so whether that's paper or fax gating or telling someone to come pick up a CD, whether that's saying you've got to use my form, right? That's not going to be acceptable any longer from our understanding. If the authorization is compliant, you must accept it. That is going to be viewed as information blocking. I know it can be frustrating. You've built processes that you feel are strong and compliant. Having to revisit those has its own challenges. And so just to restate it, we really help our clients, and we believe that all systems have to design for access by default. Our 5-day turnaround time guarantee and our pathways that we've built and our teams really help you demonstrate that there is no blocking and provide some ample evidence that we can back you up to support any claims of that. And so we know there's actors out there that aren't always they're requesting data that maybe we don't feel like that's the right way to do it because it's either new or the requester type is unclear. We will help with that. We know how to get to the bottom of the requester type solutions. We know from our experience over the last decade, when we need a release and when we don't, and we want to back you up. And to talk a little bit about ChartRequest and it's really important for everyone to understand this is a two-sided marketplace. We're not just a retrieval firm where we go gather data from healthcare providers. We are not just a release of information provider, right? It can be confusing sometimes, but I like to preface everything that we are truly provider first. And so what we want everybody to take away from this is every stakeholder either needs records or needs to release records. Our job is to make both sides successful. We call it delightfully helping humans internally, right? We want to delightfully help humans move sensitive data, right? We want to do that quickly, we want to do it efficiently, and our engineering and software and client services teams work hard every day, every sprint, every quarter, every quarterly planning to make sure that happens. And so we've been a two-sided marketplace for over 10 years. We've defined 12 requester types, including patients and providers that need to coordinate care. And we continue to innovate around each of these workflows. We have healthcare provider clients that have adopted our best practice workflow automations around release of information that have a less than 24-hour turnaround time. And that's measurable. We have a date stamp that comes in when the requester submits the request, not us, but the requester, and we have a date stamp that shows when that request was produced. It's down to the second, right? And so when it comes back to proving that we're not blocking, that we're aiding your organization, we believe that's paramount, right? To show both sides that everybody's working good faith to coordinate care in the healthcare system. Our health plan and our enterprise retrieval clients receive records for audits, payment and operations, We release those in average about 12 days, right? And this is a mix of interoperability and automation where possible. But we have teams that are on the phones, and we have fax automation and software that keeps us super organized and allows us to be most effective for our clients. So we can enable you, any organization, to request and receive data through an API, regardless of the downstream source. Someone might have paper, we will get that, and you can get it through an API, right? We work with the current state. We know where healthcare is from our experience, and we think that's important. We are built for software automation, but we're staffed so that every single request can be fulfilled. We can perform at this level, whether you have 20 requests per month or 20,000 requests per month. And the way we do that is continual innovation, listening to our clients, caring about both sides of this marketplace. We leverage interoperability platforms and integrations, but we also onboard and credential 50 to 60 healthcare provider organizations to our network every single week that needs healthcare data. We verify them stringently with human interaction, with documentation that allows us to make sure they are who they say they are. So from our provider canvassing tool, where we help you see where a patient was seen, to our trusted provider framework that lets healthcare provider organizations kind of design around trust and assign trust levels to different healthcare provider organizations, so we can enhance speed and access to care. Those are tools that we have come to market with that we're excited to share, that enable both our network, our growing network, as well as the other growing networks. So every stakeholder either needs records or needs to release records, and we help with both. It's really the only way to reduce friction. If you're a one-sided platform where you're just doing release of information, or you're a one-sided platform where you're just retrieving records, there's always going to be some consternation. There's always going to be friction. One side will not believe the other side is providing commercially reasonable best efforts to produce this data. And we believe that we get both sides transparency, exception workflows, and communication workflows that really makes this possible. And it's really all centers around trust. So we can talk a little bit about the ChartRequest approach. And so again, we're designed for access and simplicity, but with an open market concept, where we facilitate a secure request workflow with strong service, right? Service is something that is super important to us. We actually think that our Google reviews are very important. This is a pulse on how our teams are doing. We'd encourage you to check our reviews. We encourage you to check all your vendors' reviews. These are extensions of your brand. If we are sitting between health data, between your patients or your referral networks, we need to be representing you the best that we can, and we believe we do that. And we do that by combining the most advanced and the only purpose-built healthcare data marketplace software platform in the United States. We have a blend of innovation and acceptance of our current state workflows. And so we build with the fax machine in mind. We work to displace it, but that is the primary system of healthcare data movement. So we have to acknowledge that. We can't just assume the fax is going away without our willful leverage of that, and using that to make sure we're meeting people where they are. Your fax machine's not free, right? So there's a cost associated with fax machine. We have built our internal tools, our internal fax servers. And so when you onboard with ChartRequest, you'll be eliminating that cost. And tactically, so how do we do this? So we have three approaches, right? So direct retrieval enablement. So this is when we assume the release of information responsibility for a healthcare provider organization, we then design and orchestrate a workflow that meets our clients where they are. And so that allows for direct retrieval. Those are clients where they're using our software and our teams, or our software and their own teams, depending on the model that suits the client best. Second, we have a network of networks approach. So we leverage and become your representative on the network of network rails, such as Care Quality or Commonweal and other health data exchanges for treatment purposes, right? So we want to enable that care coordination through network of networks. And then when it comes to basic retrieval automation, right, the networks are not a silver bullet. And depending on the data you need, a failover process is required. We've had so many clients come to us that have maybe been sold a bill of goods around, an API, right? And they've and then they realize that it doesn't work or doesn't meet their needs, or their use case is not permitted, right? And so we help people understand that during our consultation, but we have a fax and human automation failover. So so when your team brings any one request to us, we can process, we can manage that for you, whether you're submitting through an API or not. So there are a lot of new entrants to healthcare IT space. They're trying to build one API for everything. And while we fully support that mission, it's not a practical reality to gather that data, the data you need solely from networks. So you got to have an exception workflow, and a backstop of manual retrieval is required. And we do this daily. That when the network plumbing is not yet available, right? Our teams are ready to make sure that if you're a health plan or you're a healthcare provider and you need data, you don't have to have multiple vendors to source that. We'll get it through the networks, or we'll get it for you manually through fax automation and phone calls. And so, again, you're going to hear me say this a couple times, but we're designing for access and speed. You will be able to use one API with ChartRequest today if you're ready. You can post, you can get data while our teams do the lead work, because 30 to 40% of the requests that are going to go out are not going to be fulfilled on the network approach, are not going to have the entire data set you need. We are helping healthcare get there. We strive for that mission every day, and there's a lot of partners out there that we have that help us with this. But right now, manual retrieval is still required for your daily business. When we think about the tangible benefits for providers, these are pretty apparent, we believe, but we really create less friction for HIM teams. Whether you're trying to staff up a new team, whether you just acquired a new organization, whether you're growing and you have growing pains, you may decide one of two pathways. Partnering with ChartRequest, letting us enable that release of automation workflow, and either use our team members or your team members, right? With our software, we will create the transparency that you need to manage and scale large teams. We've got simple scheduled reports, we have ad hoc reports, and our reporting and all reporting in this segment is only as good as the data that goes in. And without a two-sided marketplace, I would highly encourage you to second guess the original timestamp. Wonder, when was that release submitted? Did that fax come in 5 days before and it was timestamped by someone today? Or was it really submitted today? And so the requester network in our marketplace wants to help, right? They want to make sure that you have all the data complete on the right forms, right? So they're willing to go that extra step, right? Make sure you have that right data, submit that request in an electronic format on their own. We've been doing this with requesters for over 10 years, and they're ready for it. They're excited about it. They know it's measurable. And with workflows that allow you to say, that was incomplete, we can reset timestamps. We can help everybody understand exactly where something is. And everybody just needs more communication. We feel like we really help with that and help with transparency. And so whether you're looking to reallocate staff to higher value work, regardless of what you're doing, what I want everyone to understand is we enable our clients to have a industry first 5 day or less turnaround time guarantee, and we will put that in a contract SLA. We believe we're the only player in this space that will do that. We do that because we usually deliver around 2 or 3 business days, and we know we can beat it, and we know we're getting better every single week. So when it comes to innovation, right, you can't innovate without keeping your compliance and trust with everyone in the right place. And so, from our perspective, security is not a badge like you're kind of seeing. Like, it's not a SOC 2 badge or a high trust badge. It's a behavior, right? And we've gone 13 plus years without a reportable breach across over 18 million requests, I believe, when I looked this morning. And so I think that tells you how we behave when nobody's watching. I think that's really important, right? It's really important for us to keep our culture that way, our QA workflows with checklists, right, that are used by our teams or used by your teams, right? Allow two sets of eyes if needed on a request. But from our path values to being employee owned and service led, we show up every day. Our ChartRequest team shows up every day, working to make the software better for your teams and make the software better for our teams. We are one of our own customers, so we know what we need to fix most of the time, and we work hard at that. And one point I'll make is, when you think about uh, partners in this segment, I believe that every single vendor, either on the legal retrieval side or retrieval side, or on the release of information side, is now private equity owned. So private equity's consumed a lot of healthcare from services to technology. And I believe we're the last and only employee owned firm with scale that could service healthcare systems. And I think from my experience working in private equity and seeing the good and the bad of it, um, I believe our bottom line can be focused on outcomes and focus on our clients. One of the things that you'll hear me say is we will always want to be your best vendor. We want to be your best partner. We ask for that in every quarterly business review. Anytime we can make sure we're doing that. That's what we strive to do as a team. And so when we talk about how we're showing up for our clients, when we think about our purpose, that we talk about internally, right? It's saving lives, saving trees, and saving time. We are mission driven, and our teams are mission driven. Our path values are on every single job description. We have had a monthly all hands every month for the last almost 5 years, every single month, where we communicate to our team members that we care about, that we want them to succeed and grow with our clients. We think that's super important. But when we talk about the real world impact that we have, right? I'll give you a few examples. We onboarded a large multi-state, I think 5-state orthopedic group recently, and a large organization, and they were like, "Hey, we really want you guys to be able to, deliver records and invoices and communicate with the requesters through text or email directly." It's like, okay, tell us more. And so we listened, right? And in it was about 4 or 5 weeks, they trusted us to deliver on our promise. They wanted it. We said, we'll do it. We listened to them. We treated them like internal stakeholders, treated them like external stakeholders, and we delivered that feature, I guess, about 4 or 5 weeks. And so it was before they had even finished their entire rollout. And so we think that is a testament to we like to listen and respond to our clients. If there's a feature that they feel is a gap and we feel is value add to all of our partners, we want to bring those to market. We have another hospital CFO, right? We've automated almost 80% of their data releases, and then we have a very large mini box physical therapy partner, and they push us all the time to do better, well beyond our 5-day guarantee. And when we had a 3-day turnaround time, 72-hour turnaround time on all requests that come into their platform, meaning some are going out, a couple hours, some are taking a little bit longer due to paper processes. They said that's not fast enough. I'm like, okay, how fast do you want it to go out? And they're like, we want you to get to 2-day turnaround time consistently. And we challenged our team. We said, we're going to do this. And it wasn't just staffing. It was a mix of the client partnering with us, changing some of their workflows, us changing some of our workflows, and getting there quickly. And so we think it's super important to have a real world impact. We talk about interoperability in software, but if there's a need that our clients have, I think it's super important that we're always listening. And one of the things that um, you know hopefully we can do forever, but we have a piece of paper, a client escalation guide that we give to every client during onboarding. And it's just one page. We want you to print it out. We want you to laminate it. We want you to keep the PDF nearby. And it shows you an escalation pathway. And at the end of that escalation pathway is my personal cell phone number. and I've gotten phone calls, right, of folks that have escalated, and we have successfully solved their problems. We have, a lot of times it's just communication challenges between teams where that's what we need to solve. It's rarely ever software. It's usually people related, and we always do our best. But my cell phone is available to every single ChartRequest client, and I'll get a text here and there of someone that wants help, and then usually within 24 hours I'm there to help. And it's not because we're a small organization that we do this. It's because we're a strong client first organization. And I believe if you can't reach the CEO of the organization, then you may not be with the right partner, right? Because you matter. Whether you're one of our one doc practices, we've had a one doc spine surgeon in California working with us for years, and we've had um, many thousand box multi-state enterprises working with us for years, and so we're always here to help. And so when we talk about the future and what we're trying to do, and the vision of what we're trying to do, right? Um, we really want to be the quiet, kind of dependable mountain, so to speak, right? That's our little metaphor internally, right? We want to integrate with your systems. We want to show value at each step, and we want to help you build your ecosystem. And we really, our North Star goal is to process our billionth request by 2032. And we know that we have to build more and more automations into our workflow to be able to do that. And so before we move into a little bit of Q&A here, one of the things I just want to say is, we want to be your best vendor, right? And that's our goal. We want to help our clients stop hiring for paper and hire for patient care. We want to help move that paperwork to the network. And when it comes to release of information, if your default answer is I'll fax it or I'll mail a CD, the new enforcement posture may put a clock on that habit. And so we can help, whether it's medical images. You don't want to burn CDs anymore. We've been digitizing those for the last 10, almost 9 years. It was a compression challenge, moving files that large, but we've been doing it for a very long time. You don't burn CDs. You don't burn DVDs. You don't need postage. You don't need to send things in the mail any longer. We're going to help you become fully electronic. And if you're on the retrieval side and you want to be fully electronic, we have a partner right now that is pushing us to advance our API even further. They've got tens of thousands of requests they want to put in every single month, and we are working hard to scale our infrastructure to do that. And so thank you guys so much. When it comes to next steps, for everyone on this call or anyone that listens to this webinar, we just want a chance to prove ourselves. Even though we've been around for 10 years, we are still probably a relatively new vendor, right? People maybe don't know our names all the time. But what we ask is, hey, when your relationship is coming up for evaluation with your current partner, or you're making evaluations on tough budget decisions, when it comes to this workflow, we know we can help. We can help CFOs navigate this department, help make the right decisions that are best for your organization and people. And we'd love to be able to have a chance, have a 30-minute call to show you how we automate, to show you how we have a guarantee around 5-day turnaround time. We know states like Wisconsin and others, you cannot charge for medical records anymore. We think that is exactly where everything will ultimately go. And we are positioned to be your vendor of choice now that you've created budget through paying a vendor directly for that work. And so whether you want to bring that back in-house or you want a vendor that has all the traits and attributes we described today, we want to hear from you. And we think about interoperability, right? I'll before I cap it over, we'll say interoperability is a human experience, right? It's when data moves, people on both sides of our marketplace breathe easier. So let's pick a flow. Let's pick a workflow, whether you need us to go gather data for you or you need us to help you with the outflow of data. But give us 30 days to prove what we can do. Let's measure it together, right? and we'll be your quiet, dependable partner, and we'll always be super responsive. And so, thank you everyone so much, and we'll look forward to some questions.
Great. Thank you for that, Chris. That was a lot of really good information. I did get 2 questions in the chat, just private chat. One of them was, how does a robust interoperability strategy directly impact the financial health of an organization?
Yeah, and so that's a great question. So when it comes down to the financial health of an organization, I think the best way to think about, you can put this in 2 buckets. One is, operational leverage, right? Our software creates leverage within your HIM, or referral or care coordination departments, depending on how you organize yourself. And so we know that some of our clients, before we get involved, are staffing, 1 to 10 people that are making phone calls to gather data pre-appointment. And so we believe with our canvassing tools and our provider trust network, we can not only help you find that data quickly, but whenever your referral channels, right, depending on your specialty, when folks that refer into you need data, right? Because hey, the primary care doctor referred someone over to the gastroenterologist, the PT ortho relationship, right? We can make sure through our release automations that your referral network is getting records in near real time. And when we look at our desire for a 5-day guarantee, when we say we're performing in 48 hours, that's because we have requests that are going out in 15 minutes, right? And that starts with care coordination, and that does not require human touch. And so we'd love to share how we're doing this, how we're helping our clients build trusted networks. Think about it as a version of LinkedIn for organizations to build trust amongst each other. Any other questions, Kate?
Sure. Yeah, there was one other one that came in, which is, what advice would you give to a healthcare leader who's just beginning to explore interoperability, and where should they focus their initial efforts?
I think if you are starting out in interoperability, and whether, and depending on where your experience lies, it's just understand the current state of your organization. Not all EMRs are created equal, and various IT departments have different challenges, right? Different bandwidths, and so know your organization, right? Our best champions that help bring us in to solve problems, know who to pull in to the conversation, right? A lot of times, sometimes the general counsel is getting involved early, sometimes they're getting involved at the end. Sometimes the compliance officers on the front end of the phone call, and making sure we have everything they feel like we need, and sometimes they're at the end. Most of the time, what's most important is whoever our day-to-day contact is, or your day-to-day contact around the various points that you release data, making sure you know who all those are. And so if you're in the beginning of your journey, I think it would be a fabulous exercise to map all the release of information points you actually have at your organization. You might find that release of information is a side of the desk job for everyone, and meaning it's something that takes up 1 to 2 hours a week. And we all know that if it's 1 to 2 hours a week of a 40, 50-hour week, and people are busy with primary job function responsibilities, those things can fall by the wayside. So if you're getting angry letters from lawyers, you're getting angry letters, you're getting information blocking notes, I wouldn't jump to blame it on the HIM department. I don't think that's a fair way to think about it. I think it's more of, what is our holistic approach? Do we have any type of centralized workflow to make sure all requests that are coming in are categorized and reported on and timestamped? I think that's what we provide. That's most important, is when that request comes in, it's got a timestamp. and everybody knows what it is. And as you grow, as you grow in your knowledge of your organization, building trust between those who need data from your organization and those who release data from your organization, so that everybody believes that everyone is working in good faith to coordinate care and release information is what's most important. Just building trust, and we believe reporting and transparency and 5 to 6 page of audit logs for every single request, like we do at ChartRequest, really helps back that up at the end of the day. Any other questions, Kate?
No, that was it. But I do want to encourage everyone who joined us that if you do have other questions, please feel free to reach out. You have the information for us to reach us both on the internet as well as on our website, as well as our LinkedIn page. And either Chris or myself would be happy to answer or point you in the right direction. So I appreciate everyone's time that's joined us. We will have this recording available to watch afterwards as well.
Thanks, everyone. Have a great day.
Thank you.